Hi, good morning.
Good morning.
I'm student Dr. Alfonso.
Anna.
Hi, Anna. Nice to meet you.
Yes.
Hey, Anna. So, what brings you in here today?
I stubbed my toe.
You stubbed your toe? Okay, so can you tell me what happened?
Just I was on the beach and there was this rock and I hit my toe with it.
Okay, so you stubbed your toe with a rock while walking on the beach?
Mm-hmm.
Okay, so can you point at it? Where specifically?
It hurts here and here.
Okay, is it tender? It hurts you?
It's like a tender pain. Yeah.
Okay. Can you tell me about the duration of pain? Like, well, when is the pain? Like, is it?
So it's always there,
Okay.
but it hurts more when I'm standing or walking.
Okay. Can you tell me about like the so it hurts more when you're walking. Okay. Did anything make it better?
No.
No. So okay. So it hurts, aggravated when you put weight on it, but nothing makes it better. Okay. Can you tell me about the character of the pain? Is it like achy, dull, sharp?
It's like a achy pain, tender.
Okay. Does the pain radiate anywhere up, down? No. And you could rate the pain from a scale of 1 through 10. 10 being like childbirth, and a 1 being just a touch.
Mm-hmm. So constantly it's like about a 3, and when I'm standing or anything it's like a 5.
Okay. I know. So I'm gonna ask you some questions about your past medical history. All right. So have you had any hospitalizations before?
Recently had a baby.
Was you had a baby? Was it an uncomplicated delivery? Oh, but congratulations, by the way.
Thank you.
Was it a complicated delivery? Or
Uncomplicated.
complicated. Okay, so like about 2 days in the hospital.
Mm-hmm.
Okay. Any illnesses you had, or any family member with a significant medical history?
No.
No. Okay. Are you currently up to date with your immunizations?
Yes.
Okay. Are you currently on any medications?
Prenatals.
Prenatals. Okay. Any past surgical history?
No.
No. Any transfusions?
No.
Okay. And I'm gonna ask you. Oh, I'm sorry. Any allergies?
No.
Allergic to anything? No. Okay, I'm gonna ask you some questions that might seem a little odd, right? But this is just to assess your mental state.
Mm-hmm.
Can you please state your name and the time and the place?
My name is Anna. I'm in your clinic, and it's Tuesday.
Okay. So patients alert and oriented. Okay, Anna. So I'm gonna ask you some more personal questions now. How's your sleep?
As good as it could be with the baby.
As it is to be with baby. Okay. How are you married?
Yes.
I said a monogamous relationship.
Yeah.
Okay. Do you smoke?
No.
Do you drink?
No.
No. How's your diet?
It's so.
So like healthy whenever you can.
Mm-hmm.
Okay. You exercise?
I'm a little sedentary.
Low sedentary. Okay. Any drugs or anything like that? No. So do you have any pets at home?
2 cats.
2 cats. Okay. Do you travel a lot out of the country?
No.
No. And are you working right now?
I'm a maternity leave.
Maternity leave. Okay. So right now I'm gonna do dermatological assessment. Okay. I'm gonna check for any bumps, nodules, or any lacerations, or any xerosis, which is extreme dryness. So we'll have that. We have good hair growth. Okay, I'm gonna check interdigital spaces for any macerations, sloughing. No. Okay, so no nodules, no bumps, no hyperpigmented lesions. Okay, I'm gonna be careful here because I know it's probably very tender. Okay, I do see some redness there. Okay, so no. Okay, macerations. Okay, it's good. Yeah, so I'm gonna check right now your musculoskeletal set. I'm gonna check for range of motion to see if I hear any crepitations in your joints or how your joints might be doing. So I'm gonna test your subtalar joint, range of motion. Okay, tarsal joint, ankle joint. Okay, so I don't hear any crepitations there. Okay, so you have good range of motion. Of course, metatarsophalangeal joint. Okay, so good range of motion. Okay, I do notice this is a little, range of motion here is a little decreased, and I do notice some tenderness here, so I'm gonna leave it alone. Okay, but otherwise it's good. Anna, I'm gonna need you to screw back for me real quick. Thank you. Okay, I'm gonna assess the muscle tone of your plantar flexors, dorsiflexors, inverters, and everters. So if you could push towards yourself, good. Push towards me. Push away. Push inside. All right, so there's good tone there. Okay, check right now for equinus. So subtalar joint neutral. See some dorsiflexion there, like about 10 degrees. I'm gonna flex your knee quick. Okay, no equinus present. About 10 degrees here. Joint neutral. Okay, no equinus present. Okay, Anna, you have, let's see. So you have palpable pedal pulses, right? Both in the posterior tibial and the dorsalis pedis. I'm going to check. Okay. Capillary fill time within 3 seconds each. That's good. Temperature 1 to warm. Skin turgor. It's good. Indicates good hydration. There is present hair growth. There is absent varicose. I'm going to check a DVT test. So now you need to tell me if you feel a sharp pain. Okay.
No. 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 Yes.
Okay, no. So negative Holman sign. Okay. So if you could scoot forward for me, I'm going to check for your Achilles tendon and your patellar tendon reflexes. Okay. Okay, so there's intact patellar and Achilles tendon reflexes. Okay, Anna, so I'm sorry, can you scoot back for me one more time? Thank you. Okay. Okay. That's a negative Babinski sign. Okay, Anna, so I'm gonna do what's called vibration test, right? So I'm gonna need you to close your eyes for me and tell me whenever you feel the vibration start and when you feel it stop. Okay?
Start. Stop. Start. Stop. Start. Stop. Start. Stop. Start. Stop. Start. Stop.
Okay, so that's intact vibrating setting. Okay, so I'm gonna do right now a proprioception exam, and I'm gonna need you to tell me which toe am I touching and in which direction am I moving while having your eyes closed.
Mm-hmm.
Okay.
Is the big toe up, down.
Okay.
Little toe up, down. Little toe up, down. Middle toe up, down.
Okay, good. Intact proprioception. Okay. I'm gonna do right now a sharp and dull exam. Okay. So just to give you an example, Anna, of what a sharp and dull is, I'm gonna poke you. This is sharp, and this is dull. Okay. So I'm gonna need you to close your eyes for me one more time and tell me whether you feel sharp or dull. Okay.
Sharp. Sharp. Dull.
Okay.
Sharp. Dull. Dull.
Okay. Yeah, and I'm gonna one more time. I'm gonna need you to close your eyes for me, right? And every time I touch you, I need you to say yes, or whenever you feel a touch, say yes.
Mm-hmm.
Okay.
Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Okay. So that is a 10 out of 10. Seems one time on the filament on bilaterally. Okay. And okay, I don't. You can come forward. So what I believe you have is a first metatarsophalangeal joint sprain, and you might have a little bit of a plantar plate rupture under there because it's, when you stab when you hit your toe on the beach, it might have, you know. I do not think it's broken, right? But I'm gonna have you take an X-ray for me, right? So for the pain, I want you to take 600 milligrams of ibuprofen 3 times a day or as per needed, right? I'm also gonna prescribe you a negative Martin, a reverse Martin's orthosis, right?
Mm-hmm.
Which just offloads the pressure of that toe. You don't have to get it, but it will help, right? So what I want you to do is have, avoid any aggravating factors, anything that makes the pain worse, right? I want you to rest as much as you can, and I want you to come back to see me in a week, right? And that way we can discuss the X-rays to see if there's any further treatment that you might need. Okay. So do you have any questions for me?
No.
No. All right. Thank you so much.